Bariatric surgery, better known as weight loss surgery, doesn't always solve the problem of obesity.
In fact, the weight tends to come back. We're here with Dr. Emily Cooper from the Diabesity Research Foundation, the author of Metabolic Storm. Good to have you here again, Dr.
Nice
Cooper.
to be here.
Let's talk about, first of all, what this surgery is, what actually happens.
Well, most people think that bariatric surgery works by forcing the person to eat less food because these surgeries do shrink the size of the stomach. But actually, shrinking the size of the stomach activates dozens of key important metabolic hormones that actually improve the body's ability to sense food and to burn fuel. And these hormonal changes occur within hours after the surgery. But unfortunately, the effects begin to wear off over time. So people will lose a lot of weight initially over the first couple of years, and then many patients do start regaining weight, and they're devastated because they thought the surgery is a permanent fix.
Right. Explain the different types, because I know there are different types of bariatric surgery.
And there are two really popular types. One is the gastric bypass, which actually does reduce the size of the stomach and bypasses the portion of the gut that absorbs the nutrients from the food we eat. The other popular surgery is the VSG, which reduces the size of the stomach but does not affect our food absorption. And the VSG has another beneficial effect because it removes the part of the stomach that makes the majority of the hunger hormone ghrelin, which is a hormone that can become detrimental to metabolism. So removing that can be advantageous. And these two surgeries have been linked to major improvements in type 2 diabetes. So around the world, experts are actually beginning to recommend this type of surgery to treat diabetes regardless of weight because of these important metabolic effects. There is a new procedure that's really promising where you pass a scope through the mouth and the surgeon actually stitches the stomach from the inside, making the stomach smaller without any incisions. So this would be far less invasive, and we don't really have long-term data to know the risks and benefits, but so far it's really promising. And the one thing I'll say is there's some radical devices, like an aspiration device that removes the contents of the stomach after eating, and another one that's a balloon that sits in your stomach that can cause erosions and blockages. So I never recommend those.
Wow. How do we sort all of this out? I mean, is there definitive research back on these procedures yet that people can talk with their
Well, the
doctors
funny
about?
thing, it's been going on since the 1950s, so we have a lot of research. And really, the answer is still elusive about obesity treatment, but the future is really promising because medical treatment is becoming more effective and surgical treatment is becoming less invasive, which is really great.
Obviously, not everybody can have these surgeries.
Everyone cannot have these surgeries. And the treatment really has to be individualized. And as I said, the medical treatment is becoming much more powerful. So if you're considering treatment for obesity, it's important to see your physician, find out really if you're a candidate for medical treatment. And you have to remember, obesity is a metabolic disease. It is a medical condition. So every expert that knows anything about metabolism now knows that diets do not fix the problem long term. So we really need to look at medical treatment. And if you're considering surgery, whatever you do, don't act out of desperation. Find out the risks and benefits. Talk to your healthcare provider.
Yeah, I've talked to people who went to Mexico to get surgery because it was cheaper down there. I'm guessing you don't recommend that.
You know, the funny thing is our insurance policies are really harsh on people with obesity. So we really have to work as a society to push for medical coverage for weight-related treatment. That's both medical treatment and surgical treatment. And until that happens, people will be going out of the country to get these procedures done because they really can't afford it to pay out of pocket in the U.S. for it if their insurance isn't covering. Because as I said, everyone who knows anything about obesity now knows it's a medical problem. It's a metabolic problem. So that's eventually will have to be covered by insurance companies.
That shift has been slow to come.
That shift is slow to come, but it's happening.
Good.
Especially with this link to diabetes.
Yes.
The ability to
really link it to the metabolic system and to understand that these surgeries do more than just stop people from eating food. So.
Okay. Dr. Emily Cooper, always good to see you.
Thanks so much for having me.
Thank you.